I want you to try something with me right now. Swallow once, just once. Now pay attention to the back of your throat. Do you feel anything there? A little thickness, a coating, a sticky feeling that seems to sit there no matter how many times you clear your throat? Maybe you woke up this morning, took a sip of water, cleared your throat once, then again, and somehow it still felt like something was stuck back there. Now let me ask you something important. How long has this been going on? For many people over 55, the answer is not clear, because this problem usually does not begin suddenly. It sneaks in quietly. At first, maybe it only happened in the morning. You woke up with a thick throat, cleared it a few times, drank some coffee, and moved on with your day. Then it started lasting longer. Maybe it showed up after meals. Maybe it became worse at night. Maybe you started carrying water with you everywhere because your throat always felt coated, and before you knew it, constant throat clearing became part of your normal life. You may have tried cough drops, you may have tried honey, you may have tried drinking more water, you may have avoided dairy because someone told you milk creates mucus, maybe a neighbor told you to try apple cider vinegar, maybe a family member told you, oh, that's just what happens when you get older. But here is what I need you to understand today. Persistent mucus in the back of your throat is not random, and it is not something you should simply ignore because of age. Your body does not create symptoms for no reason. When something keeps happening again and again, especially every day, your body is trying to tell you something. The problem is that most people do not know how to interpret the message. Today, I want to help you understand that message clearly. In my work with older adults in preventive health and senior wellness, I have seen persistent throat mucus misunderstood more than almost any other symptom. People are told to drink more water. They are handed lozenges. They are told it is allergies. They are told it is just aging. But very often the real cause underneath the symptom is never properly discussed. And that matters because if you do not know what is causing the mucus, you can waste months treating the wrong problem. So today, we are going to go through 5 common research-supported causes of persistent throat mucus in adults over 55. And more importantly, I am going to explain which causes often work together, because in real life, these problems rarely happen in isolation. One cause can make another worse. A little reflux may create more irritation. A little dehydration can make the mucus thicker. A medication side effect can increase throat sensitivity. A sinus problem can keep dripping mucus down the back of the throat all day. And when these factors stack together, the result can feel like a throat that never gets a break. My name is Dr. Franklin, and here on Health 360 Days, my goal is simple: plain language, practical health guidance, and steps you can actually use in your daily life. Before we go deeper, do something for me. Write in the comments, is your throat mucus worse in the morning, or does it stay with you all day? Just type morning or all day. That one detail can give a big clue about what may be driving the problem. And if this kind of clear doctor-style explanation is helpful for you, make sure you subscribe to Health 360 Days and turn on notifications, because this channel is here to help you understand your body after 55, 60, 70, and beyond. Now let's begin with a piece of biology most people are never taught. Your body produces mucus every single day. That is normal. In fact, it is necessary. Mucus is not your enemy. Mucus protects your airways. It catches dust, bacteria, viruses, pollen, smoke particles, and other irritants before they travel deeper into your lungs. It keeps the delicate lining of your throat moist. It helps protect tissue from drying, cracking, and becoming irritated. Without mucus, your airways would be far more vulnerable, so the goal is not to eliminate mucus completely. The real question is this: why is the mucus becoming too thick, too noticeable, or too persistent? To understand that, we need to talk about a system in your body called mucociliary clearance. That may sound complicated, but the idea is simple. Your airways are lined with millions of tiny hair-like structures called cilia. Think of them like microscopic brushes. All day long, these cilia move in coordinated waves, sweeping mucus upward and outward so it does not sit and collect in the throat. In a younger adult, this system usually works quickly and efficiently. Mucus is produced, moved, swallowed, or cleared without much thought. But as we age, the cilia can slow down. They may not beat as strongly. They may not move mucus as quickly. So mucus that might have cleared easily at age 35 or 40 can begin to sit longer at age 60, 65, or 70. That does not mean your body is failing. It means the system is less efficient than it used to be. And that makes older adults more sensitive to anything that increases mucus production or thickens mucus. This is why a small trigger can feel much bigger after 55. A little reflux may create more irritation. A mild sinus issue may produce more drainage. Mild dehydration may make mucus stickier. A medication may irritate the throat just enough to keep you clearing it all day. So with that foundation in place, let's go through the 5 major causes, because number 1 is one of the most commonly missed reasons for persistent throat mucus in adults over 55. It is called laryngopharyngeal reflux. Most people know about acid reflux as heartburn. You eat a heavy meal, lie down too soon, and feel burning in the chest. That is classic reflux. But there is another kind of reflux that is quieter and more deceptive. It may not cause heartburn at all. No burning chest. No obvious stomach discomfort. No sour taste. Instead, it shows up as throat symptoms. A coated throat, frequent throat clearing, a hoarse voice in the morning, a feeling that something is stuck in the throat, thick mucus after waking up. This is often called silent reflux. Here is what happens. Between your stomach and your esophagus, there is a muscular valve. Its job is to stay closed after you eat so stomach contents stay where they belong. But as we age, that valve can lose some tone. It may not close as tightly. When that happens, tiny amounts of stomach acid or digestive fluid can travel upward. And sometimes that irritation reaches the throat, the voice box, or even the back of the nasal passages. Now here is the important part. Your throat tissue is not designed to handle acid. Even a small amount of acid reaching the throat can trigger a protective response. Your body produces thicker mucus to coat and protect the irritated tissue. That mucus is not the original problem. It is your body's defense mechanism. But if the reflux keeps happening night after night, you may wake up every morning with thick mucus and no idea that your stomach is involved. This is why many people miss the connection. They think, it cannot be reflux because I do not have heartburn. But silent reflux often does not feel like heartburn. It feels like a throat problem. So ask yourself, is your mucus worse first thing in the morning? Does your voice sound rough when you wake up? Do you clear your throat more after lying down? Does bending forward make the throat sensation worse? Do symptoms increase after late meals, spicy foods, fried foods, chocolate, coffee, or alcohol? If yes, silent reflux may be part of the picture. And one more thing is important here. If you regularly take anti-inflammatory pain relievers such as ibuprofen or naproxen for joint pain, arthritis, or back pain, talk with your doctor. These medications can irritate the stomach lining and may make reflux more likely in some people. Do not stop prescribed medication on your own, but do bring up the connection with your healthcare provider, especially if your throat symptoms have been persistent. Before we move to cause number 2, write your name and where you are watching from in the comments. I really like knowing who is part of this community, and your comments also help other viewers feel less alone, because number 2 is chronic post-nasal drip. Now, when most people hear sinus problem, they imagine something dramatic: a blocked nose, facial pressure, a pounding headache, thick discharge, a full sinus infection. But in many adults over 55, sinus inflammation can be much quieter. You may breathe mostly fine, you may not have a headache, you may not feel sick, but your sinuses may still be mildly inflamed, producing extra mucus and allowing that mucus to drain slowly down the back of your throat. That drainage is called post-nasal drip, and it is one of the most common reasons people feel mucus sitting in the throat. The frustrating part is that many people treat post-nasal drip as if it is always allergies. They buy antihistamines, they take them for weeks or months. Sometimes they get a little relief, but often the problem does not fully go away. Why? Because antihistamines may dry secretions temporarily, but they do not always fix the underlying inflammation inside the nasal passages and sinuses, and sometimes drying the mucus can make it thicker and stickier. So instead of thin mucus draining easily, you get thick mucus sitting at the back of the throat. That can feel even worse. This is where one simple habit can make a real difference for many people: saline nasal rinsing. A warm saline rinse helps physically wash away mucus, allergens, dust, irritants, and inflammatory material from the nasal passages. It also helps keep the nasal lining moist. And for older adults, this matters because the natural mucus clearing system we talked about earlier may already be slower. The key word is consistency. Doing a rinse once and expecting a miracle is like going to the gym one time and wondering why your muscles did not transform overnight. Daily practice matters. A saline rinse used correctly for 1 to 2 weeks may give a much better picture of whether post-nasal drip is contributing to your throat mucus. But safety matters too. Never use straight tap water for nasal rinsing. Use distilled water, sterile water, or water that has been boiled and then cooled to a comfortable temperature. Use the proper salt packets or the correct saline mix, and clean the device regularly. A squeeze bottle or neti pot can be helpful, but it must be used safely. If your mucus seems worse during allergy seasons, after being around dust, after sleeping with a fan blowing, or when the air is dry, post-nasal drip may be a major piece of your puzzle. Now, if you are still watching and this is making sense, type number 2 in the comments. That tells me you are following along. And if you have not subscribed yet, please do. Health 360 Days is built for people who want practical health education without confusion, fear, or complicated medical language. Because number 3 surprises many people, it is medication-related throat irritation. And this is especially important for adults over 55 because this is the age when many people begin taking long-term medications for blood pressure, heart health, diabetes, pain, or other chronic conditions. One medication class in particular is known for causing throat symptoms in some people. These are called ACE inhibitors. They are commonly used blood pressure medications. They can be very effective and very important, but they can also cause a persistent dry cough, throat tickle, throat clearing, or irritation in certain people. The reason has to do with a substance called bradykinin. A CE inhibitors can allow bradykinin to build up in the body. In some people, that buildup irritates the airway and throat. The result may feel like a cough, a tickle, mucus, or a constant need to clear the throat. Here's the tricky part. This side effect does not always happen right away. It can show up weeks or even months after starting the medication, so a person may begin a blood pressure pill in January, then start noticing throat clearing in March or April, and never connect the two. They think, if the medication were causing it, surely it would have happened immediately. But that is not always how this side effect works. The timing can be delayed. This is why reviewing your medication list matters. If you take medication for blood pressure and you do not know whether it is an ACE inhibitor, ask your pharmacist. They can usually tell you very quickly. Common ACE inhibitors often have names ending in pril, such as lisinopril, enalapril, benazepril, and others, but do not diagnose yourself. Do not stop your medication suddenly. Blood pressure medication protects you from serious problems like stroke, heart attack, and kidney damage. The right step is to speak with your prescribing doctor. Ask clearly, could this medication be contributing to my throat clearing or mucus? Is this an ACE inhibitor? Would another class, such as an ARB, be appropriate for me? ARBs are another type of blood pressure medication that may not cause the same throat side effect in many people. But your doctor needs to decide what is safe based on your full health history. If you have had persistent throat clearing for months and you are taking blood pressure medication, this conversation is worth having. Write down your timeline before your appointment. When did the throat symptoms start? When did you start the medication? When did the dose change? Did the symptoms worsen after any medication adjustment? This kind of timeline can help your doctor see a connection that might otherwise be missed. If you are still here, type the word clarity in the comments. Because clarity is exactly what I want you to have. You should not have to live with a symptom for years without understanding the possible reasons behind it. Because number 4 sounds simple, but do not dismiss it. Hydration. Now, I know what some people are thinking. Doctor, I already know I should drink more water. But this is not just basic advice. There is real physiology behind it. Mucus is mostly water. When your body is well hydrated, mucus tends to be thinner and easier to move. When you are even mildly dehydrated, mucus can become thicker, stickier, and harder to clear. Think of syrup. When syrup is fresh and warm, it pours easily. But when it sits out and thickens, it becomes sticky and slow. Mucus behaves in a similar way. And here is the aging-related problem many people do not realize. Your thirst signal becomes less reliable as you get older. A younger adult may feel thirsty early before dehydration becomes meaningful. But many older adults do not feel thirsty until they are already behind. So if you wait until you feel thirsty, you may already be mildly dehydrated. And that mild dehydration, repeated day after day, can make throat mucus thicker and more noticeable. This can be especially common if you drink mostly coffee in the morning, very little water during the day, or avoid fluids in the evening because you do not want to wake up at night to urinate. That is understandable. Nobody wants to spend the night walking back and forth to the bathroom like their bladder is running a midnight business. But cutting fluids too aggressively can backfire. It may make mucus thicker. It may worsen dry mouth. It may make you feel tired or lightheaded. It may also affect digestion and constipation. A practical approach is to drink steadily earlier in the day instead of trying to catch up at night. Start your morning with warm water before coffee. Keep water visible. Drink small amounts consistently. Include herbal teas, soups, fruits, and water-rich foods. Cucumber, melon, oranges, berries, broth-based soups, and warm teas can all contribute to hydration. If you have heart failure, kidney disease, or you have been told to restrict fluids, follow your doctor's guidance. But for many adults, intentional hydration can make mucus easier to clear within days. If this part is useful, type number 4 in the comments and tap the like button if you want more simple explanations like this. It helps this video reach more people who may be silently struggling with the same issue. Because number 5 is one most people do not expect. Your gut health. Yes, your gut can influence your throat and airways. At first, that may sound strange. After all, the mucus is in your throat, so why would the gut matter? But the body is connected. Your digestive system, immune system, nervous system, and respiratory system are constantly communicating. Researchers often refer to this relationship as the gut-lung axis. Your gut contains trillions of bacteria known as the gut microbiome. When that microbiome is balanced, it helps regulate inflammation and immune function. But when the microbiome becomes disrupted, a state sometimes called dysbiosis, it may contribute to more inflammation throughout the body, including in the airways. That can make the upper airway more reactive. And when the airway becomes more reactive, mucus production can increase. This does not mean every person with throat mucus has a gut problem. But for some people, especially older adults with chronic inflammation, repeated antibiotic use, low fiber intake, high sugar intake, stress, or poor diet quality, gut health can be part of the bigger picture. What can disrupt the gut microbiome? A diet low in fiber, too many ultra-processed foods, high sugar intake, frequent antibiotics over the years, chronic stress, poor sleep, not enough variety in plant foods. These are not rare problems. They are very common in modern life, and they become more important after 55 because the body may become more sensitive to inflammation and slower to recover from imbalance. Now let me be very clear. You cannot fix a gut airway problem with a cough drop. A lozenge may soothe the throat temporarily. Honey may calm irritation temporarily. But if inflammation is being fueled from deeper inside the body, the long-term solution has to support the whole system. That means feeding your gut better. One small daily serving of fermented food may help some people. Plain yogurt with live cultures. Kefir. A small portion of sauerkraut. A small portion of kimchi. Fermented vegetables. But choose options that match your body. If spicy foods worsen your reflux, spicy kimchi may not be the best choice. If dairy bothers you, dairy-based yogurt may not be ideal. The goal is not to force a trendy food into your diet. The goal is to support a healthier gut environment over time. Fiber is also important. Beans, lentils, oats, chia seeds, vegetables, berries, apples, and whole grains can help feed beneficial gut bacteria, but increase fiber gradually. If you suddenly go from no fiber to a mountain of beans, your digestive system may file a formal complaint. Start small, build slowly, drink enough water, and pay attention to how your body responds. Now, before we move into the action plan, I want to say something very important. Most persistent throat mucus in older adults is not dangerous. Most of the time, it is related to things like reflux, post-nasal drip, hydration, medication effects, or inflammation. But there are certain symptoms you should not ignore. Please make an appointment with your doctor promptly if you notice any of the following. Mucus that is repeatedly tinged with blood. Difficulty swallowing that is getting worse. Unexplained weight loss. A lump or swelling in the neck. A major voice change that does not improve. Pain with swallowing. Shortness of breath. Or symptoms that are worsening instead of staying stable. These signs deserve medical evaluation. Do not try to manage them with home remedies. Your body may be asking for professional attention. Now let's turn everything we discussed into a practical action plan. This is where the information becomes useful. Step 1. Stop eating at least 3 hours before lying down. This is one of the most important steps if silent reflux may be involved. When you eat late and then lie down, your stomach is still working. That increases the chance that acid or digestive fluid can travel upward. Give your stomach time. Try to finish dinner earlier. Avoid heavy late-night snacks. And if you need something small, choose something gentle and light. Step 2. Elevate the head of your bed slightly. Do not just stack pillows under your head. That can bend your neck and may actually make breathing or throat tension worse. Instead, use a wedge pillow or elevate the head of the mattress slightly. The goal is to use gravity to reduce nighttime reflux. Even a modest incline can help some people. Step 3. Drink warm water before bed and again in the morning. A full glass of warm water before sleep may support overnight hydration. Then when you wake up, drink 1 to 2 glasses of warm water before coffee. This can help loosen mucus that accumulated overnight. For many people, this is one of the simplest and most noticeable changes. It costs nothing. It does not require a prescription, and it directly targets thick mucus. Step 4. Use a safe saline nasal rinse. Post-nasal drip may be involved. Get a proper rinse bottle or neti pot. Use distilled, sterile, or previously boiled and cooled water. Use the correct saline mixture. Rinse once daily, preferably in the morning. Try it consistently for 2 weeks before judging the result. Again, consistency matters. One day is not a fair test. Step 5. Review your medication list. This is especially important if your throat symptoms began after starting or changing a medication. Write down your timeline. Bring your medication bottles or list to your doctor or pharmacist. Ask whether any medication could be contributing to throat irritation, cough, dryness, or mucus. If you take a blood pressure medication, ask specifically about ACE inhibitors. Do not stop anything on your own, but do start the conversation. Step 6. Support your gut microbiome. Add more fiber-rich foods gradually. Consider a small serving of fermented food if tolerated. Reduce excess sugar and ultra-processed foods. Prioritize sleep. Manage stress where possible. This is not an overnight fix. Gut health takes time, but if inflammation is part of your mucus pattern, improving the gut environment may help your body become less reactive over time. Step 7. Hydrate on purpose. Do not wait for thirst. Keep water in the rooms where you spend the most time. Drink earlier in the day. Use herbal tea, soups, and water-rich foods. If you worry about nighttime urination, shift more fluid earlier instead of cutting fluids too much. And if you have a medical condition that requires fluid restriction, follow your doctor's advice. Now let's talk about popular home remedies because I know many of you have tried them. Honey can be soothing. It may calm an irritated throat temporarily, but honey does not fix reflux, post-nasal drip, medication side effects, dehydration, or gut inflammation. So it can help symptoms, but it may not solve the cause. Dairy does not create mucus from nothing. That is a common myth. However, some people feel that dairy makes existing mucus feel thicker. If you notice a clear pattern, you can try reducing dairy for 2 to 3 weeks and see whether your symptoms improve. Do not assume dairy is the cause for everyone. Test your own body. Apple cider vinegar is more complicated. It is popular online, but if you have silent reflux, adding more acid may irritate your throat even more. So please be cautious. Natural does not always mean safe for your particular problem. Here is the main message I want you to remember. Persistent mucus in the back of your throat has a reason. It may be silent reflux happening while you sleep. It may be post-nasal drip from low-level sinus inflammation. It may be a medication side effect that began slowly and was never connected. It may be mild dehydration making mucus thick and sticky. It may be gut-related inflammation influencing your airways. And for many people, it may be more than one of these at the same time. That is why the symptom can feel so stubborn. But stubborn does not mean hopeless. You do not have to accept constant throat clearing as your new normal. You do not have to keep guessing. You can start with simple, practical steps. Eat earlier, sleep slightly elevated, hydrate intentionally, try safe nasal rinsing, review your medications, support your gut, watch for warning signs, and talk with your doctor when symptoms persist. If someone has told you, "That's just aging," I hope today gave you a better answer. You are not just getting older, you are dealing with specific body systems that can be understood and supported, and you deserve that understanding. If this video helped you, please subscribe to Health 360 Days, hit the like button, and share this with one person who is always clearing their throat but does not know why. That one share could help someone finally understand what their body has been trying to tell them. And before you go, write in the comments, which of the 5 causes surprised you the most? Was it silent reflux, post-nasal drip, medication side effects, dehydration, or the gut-throat connection? Also tell me how long you have been dealing with this. I read your comments and your experience matters here. Thank you for watching Health 360 Days. Take care of your body, listen to your symptoms, and I will see you in the next video.